So evening, everybody, and good evening, Dr. Bharat Phankania. Thank you so much for joining me tonight.
Hello, good evening, Emily. Good to see you.
And you too. Bharat and I go back a long way, so it's great to reconnect. Brought you in really because obviously we're going into the third wave now across the country, and certainly within Warwickshire we are seeing our local rates go up, and you know, just really wanting to push that extra message to communities around coming with us, one last effort to get vaccinated, and we'll get through this without the same impact it has previously had on our lives. So I just wondered what your kind of thoughts and reflections are about this current stage, and how we can best get on top of it.
So, Emily, what we have to look at and aim for is we need to get out of this. And the best way to get out of this is don't drop your guard, don't get infected, don't infect others. In other words, have excellent, superb, extra infection control measures, especially if you have not been immunized. So I say, look, please get immunized as soon as possible. And if you haven't been immunized, don't drop your guard. With regards to not dropping your guard, I say, observe the 3 C's and it will hold you in good stead. Don't get close to other people, avoid crowds, and avoid closed indoor spaces. And finally, wear your mask, but please wear a good quality, even a higher specification mask, but wear it properly. And then finally, the most important thing, the thing that will really see us and the nation through, is to get immunized.
Absolutely, thank you. What would you say to people that have concerns about the vaccine in terms of its safety, effectiveness?
So the vaccines, I must emphasize, were introduced in less than a year, not because corners were cut, but because all the levers, all the bureaucracy was greased and enabled, and lots of money was poured into it. And therefore, in record time, we were able to do phase 1, phase 2, phase 3 trials and found that the vaccines work and then deploy them. I assure you, no corners were cut. Now then, millions and millions of doses have now been given, and there are some rare, unusual, unexpected, but very rare side effects that we didn't know about. And this was blood clots with the AstraZeneca Oxford vaccine, for example. But the risk, I must emphasize, is very, very low. And to mitigate against that risk, we found that the AstraZeneca Oxford vaccine caused those very, very rare, greater than 1 in a million chance in the younger age group. So what we've done there is swapped from giving the AstraZeneca Oxford vaccine and we now give the Pfizer or the Moderna vaccine. So absolutely, overall, the risks, the benefits of giving the vaccine far, far outweigh the very, very, very small and rare and unusual risk of a vaccine. If I were you, if I were anyone, I would get vaccinated. It is our way out.
Absolutely. I was so happy to have my first shot just a few weeks ago. Really fantastic. And you're so right. It's amazing what can be done when money's thrown at a problem. So within Warwickshire, Coventry and Warwickshire, actually, over the next few weeks, we're going to start a roving programme of pop-up vaccination clinics. They'll be open to everyone over 18. We'll be targeting particular areas where we really want to encourage people to come forward. There's high footfall and unfortunately within some areas where we've had lower uptake to date, where there's more hesitancy. So we'd encourage people to look out for those. And they will all be giving the Pfizer vaccine. So as you say, younger, safer for that younger cohort, even though the risk of the with the AstraZeneca vaccine is very small in itself.
I wanted to say, Emily, so there are many people, especially in poorer households, where there are grandmother, grandfather, father, mother, brother, sister, and other relatives all living together and all have to go out to work. So there is lots and lots of multiple layers of risk for them. They go to work, they could get infected, they could infect everyone in that household. Then they've got elderly parents and grandparents, etc. So especially in that setting, what would I do? I would say, you people are at risk. You need to get immunized as soon as possible. It is one way to protect yourself and your family, by being fully immunized. And by being fully immunized, I mean 2 doses of the relevant vaccine, be it Pfizer, Moderna, or AstraZeneca, Oxford. Very important, especially in these sort of households where there's lots of people and you're going out to the factory, crowded buses, crowded trains, and your crowded home.
That's a really, really good point. And we're seeing in Warwickshire at the moment, with most of our outbreaks we've been seeing within the younger age cohort. So those that haven't been vaccinated or fully vaccinated yet. So particularly kind of 19 to 29 age groups, and links there with hospitality settings where, you know, OK, we're allowed to eat indoors now and meet with up to 6 individual friends from different households. And even in outdoor spaces up to 30 people. So, you know, we all need a bit of that. Obviously, it's important for our well-being to connect socially with others and share experiences. But, you know, you've already mentioned about particularly indoor environments taking care in those settings. So what would your advice be around kind of going out at this particular time when we're moving into another peak?
Well, as I say, avoid the crowds, because this is a person-to-person spread of infection. And what I would say is aim for the long term. We are nearly there. We will see better days and better times. And I want everyone, every single person, poor, rich, every class, everyone, everywhere, to be well and to be protected. And you mustn't, as a young person, say to yourself, young people don't get serious illness, so why worry? I emphasize to you, young people can get ill. Some of you young people can get serious illness, and some of you young people can also recover from your illness and go on to have this thing called long COVID, which we don't understand properly, and we don't know what it means to have long COVID. How long does it go on for? So if you are a good chess player, then your chess strategy metaphor to use would be, don't drop your guard, don't get infected, good times are around the corner, get immunized, and you are protecting yourself from 1, the infection, and 2, the possible long COVID, and then you can go out and mingle in those restaurants and eating places and social gatherings, knowing full well that you did your best to put yourself in the best possible position.
Absolutely. And as you say, is it, you know, protecting yourself is protecting your whole household, all your family members, yes, anyone else you have contact with. So, yeah, really key there. Thank you so much. Just in terms of, obviously, we're trying to encourage that one last effort from people. I'm confident. I haven't been confident to say this before, but I'm confident to say this is our final wave, our 3rd and final wave. And the vaccination's absolutely helping to get us out of that. But some people will say, well, you know, new variants are going to emerge. We'll have something else next year. You know, kind of what's the point? Is this vaccine really going to protect me in the long term? What would your response be there?
Well, Emily, that's again a very good question. And I have been immunizing and working with vaccines for over 30 years. And it is a good science. It's not a precise science. So what I want to say there is, if you are, for example, immunized with the influenza vaccine every year, there is an element of it protecting you this year and the next year as well, because there is some cross immunity when a new seasonal influenza virus emerges. So going back to our variants, my answer is, what is protecting you today will most certainly protect you tomorrow when a new variant arises. And even if it doesn't protect you fully, there is every reason to believe scientifically that it will partially protect you. So if it's not going to protect you 90%, it may protect you 70%, but that's still very good and it's good enough. So that's another reason not to say, oh, well, I won't bother because a variant will come and then what? A variant will come. It will arise. especially when we've got runaway, uncontrolled infections in Asia, Africa, South America, etc. So you want to put yourself into a position of when the variants come, you're already protected. Another reason to get immunized.
Brilliant, brilliant advice. And as you mentioned the flu vaccination program, and of course that adapts every year, doesn't it, to give the boosters, we'll try to predict which will be dominant strains and respond to that. So
yes, we do. Yes, we do. And, you know, we're so used to the seasonal influenza vaccine that it never even hits the headlines. But the point is, you get immunized, and as you get immunized, you are priming your body every year to be as well protected as can be. So, of course, when the time comes, you must take your seasonal influenza vaccine. But at the moment, we're focusing on SARS-CoV-2, and I cannot emphasize enough, one way not to get checkmate, one way to enjoy good life for many, many, many years to come is to get immunized, protect yourself, protect others, keep yourself healthy and well.
Absolutely. Thank you. Thank you so much. Really powerful message there that you've given, and really helpful to be backed up by that science as well. So, as I say, really good to connect with you again, Bharat.
My pleasure.
My old trainer is in public health, so you know, feel in good stead when I know I've got your knowledge that's informed my practice as well. So thank you.
Really, it's lovely to work with fellow friends and colleagues from so many years and to make a difference. So I hope this is helpful, and I hope we save some lives.